Hi everyone and welcome to One Autistic Person. Today I'm going to be doing a video looking at the link between autism and hypermobility. I'm also specifically going to look at a condition called hypermobility Ehlers-Danlos syndrome, or Ehlers-Danlos syndrome. And the reason why I'm going to look at that specifically is that I have recently been diagnosed with hypermobility EDS, and through researching that I found out that hypermobility is extremely common within autistic people. And EDS, there seems to also be a genetic link as well, which I'll get into in an article I'm going to have a look at on the website called Reframing Autism. And that sort of goes into some statistics to show that is the case. It's really quite interesting, but I'm also going to go through what the symptoms of hypermobility EDS, which is the most common type of EDS. There are 13 different types, but there's the rest are much less common. I'm going to go through those symptoms so that you're aware of them. I'm also going to show you a test that you can do to be able to find out whether you potentially have hypermobility, and then have a look at sort of what conversation I had with my GP and how that's how that looked and what I went through with them. And I'm also then going to go through what the treatment options were that were put forward to me, and I'll say which ones that I'm going through and which ones I've chosen not to, for the reasons why as well. So the first thing I'm going to do is I'm going to have a look at this article from Reframing Autism, which, like I say, gives statistics and a bit more understanding of the link between autism and hypermobility in general. So as you can see, this this extract here from the article that's on a Reframing Autism website, I will, like I say, I'll put a link to that in the description, says many studies have shown a strong link between hypermobility and autism, with up to 80% of autistic individuals experiencing hypermobility. This connection is not fully understood, but researchers believe that there may be a genetic component involved. Certain genes associated with autism may also play a role in the development of hypermobility. The link between hypermobility and autism is further supported by the fact that autistic individuals often experience sensory processing difficulties. These difficulties may contribute to the development of hypermobility symptoms, as the body may not process sensory input correctly, leading to over-flexible joints and muscles. I'm just going to move this down slightly, and there we go. Understanding this link is crucial for autistic individuals and their loved ones. By recognizing the symptoms of hypermobility and seeking appropriate support, individuals with hypermobility can navigate the challenges it presents and find strategies for managing pain and improving overall well-being. It is important to consult with medical professionals such as a rheumatologist or geneticists for an accurate diagnosis and access appropriate treatment options. So that's specifically hypermobility. There is also a bit further down, which I'm going to go to in a second, which shows you that there's also some correlation between hypermobility EDS, Ehlers-Danlos syndrome, and not necessarily in autistic people, but it's a study looking at mothers of autistic children and the prevalence of hypermobility EDS in those mothers. So looking at autism and looking at Ehlers-Danlos syndrome. Sorry, I keep saying Dolan's. I don't know why I keep doing that. I keep switching them around in my head. Danlos syndrome. Whilst autism is typically diagnosed by specialists in developmental pediatrics, psychology or psychiatry, and connective tissue and hypermobility related disorders are diagnosed by rheumatologists or geneticists, the link between these conditions has only recently gained attention. Despite some neurodevelopmental pediatricians testing for joint laxity in initial autism screenings, milder symptoms may be attributed solely to autism. However, a recent study by Casanova et al. In 2020 found that over 20% of mothers with EDS or hypermobility spectrum disorders had autistic children, which is a significant percentage compared to the 19% seen in autistic mothers. So that's saying that there was 19% of the people that were in that study, 19% of them, the mothers, were autistic, and 20% of them were had either EDS or some hypermobility spectrum disorder. This suggests that some forms of autism may have a hereditary connection to connective tissue disorders. The authorities express the authors express their commitment to researching this possibility to improve the lives of those living with chronic illnesses, including certain hypermobility spectrum conditions. For many individuals with these disorders, pain is a pressing issue that requires attention. And that's where it sort of sits for me. The pain was something that I'd masked for many years, and then I started to sort of realise that. So it's quite a telling amount of sort of high percentage of people, both from both studies, from the fact that 80% of autistic people potentially have hypermobility, and then also looking at the amount of mothers that had EDS. So they're quite high numbers in both cases. So what I'm going to do now is I'm going to look at the symptoms of hypermobility, EDS, sorry, so hypermobility EDS. I'm going to have a look at the symptoms of that. Like I say, I'm looking at this because of the fact that EDS is what I have, so I can talk about it from my perspective, but what I'll do is I'll put a link to where it tells you about all the 13 different types of EDS. Like I say, the other types of EDS are much less common. This is the most common by far. So let's have a look at what the symptoms are. The first one is not going to surprise anybody. It's joint hypermobility, so the ability to be able to do things with your joints that means that they do things beyond what you would expect them to be able to do. I can make my thumb, for instance. I don't know whether you can see it there, but it kind of dislocates and pushes out. And it can go quite far back, which I'll show you in a second, because there's a simple test that you can do called the 𝐵 test that's done as part of the diagnosis process for this, as the initial sort of assessment of it. I'm going to show you from me what that looks like, but there's some of them that are quite difficult to do without a flat surface to put on, and I'm not going to go through all of that, so I'm also going to put a picture up of each one as well, of seeing that. And like I say, I'll also link a link to the 𝐵 test and more information around how it's diagnosed in the description. Loose, unstable joints that dislocate easily. Now, when I was speaking to my GP about this, because I said I've only ever dislocated one of my one bone in my body. I once dislocated my elbow, but that is dislocation. So that when my thumb's doing that is dislocation. So I've done that hundreds, if not thousands of times, because I used to do it all the time when I was a kid. I used to find it soothing. I'm guessing it was kind of a stim now looking back at it, but yeah, so it can sometimes be also that you haven't dislocated it, but it feels like it's going to be dislocated, which I get in my right hip quite often. It feels that the only way I've ever been able to describe it is it feels like it's coming out of the joint, and it can cause extreme pain. And that's what that feels like. It feels like it's coming out of the joint. And she said, yeah, that quite often people will say that. And actually, it's as people get older, the dislocations happen, if they didn't happen as much when you were a kid. But you might not move as much as other kids because of the fact because of pain and things like that. One of the things that's not in this that is part of the process sort of understanding it as well is quite often having pain when you were a child and being mistaken for things like growing pains. I had mine mistaken for growing pains for about 4 years. I was in absolute agony, but I was constantly told, just push through it, just push through it, just push through it. The same as we're sort of told as autistic people to just mask, just mask, just mask. And I was clearly masking it for all those years. And it was only sort of like when it got really, really painful that I was noticing it. And that's become more and more as I've got older. The pain has happened more and more, and I've just assumed that that's what happens as you get older. But it's not just aches and pains; it's agonising. The arches of my feet drop so that the bone kind of and tendons come down, and I have to push it back in. My toes also separate out like this. So this was my big toe, and this was my toe next to it. They'll actually separate from each other. My shoulders, I can put my fingers under my shoulder blades. I can there's loads of things. There's loads of things that it can present in so many different ways. But that's where it sort of comes from. What I'm talking about with the loose joints is that your joints may been able to do things a lot more when you were a kid, and it wouldn't have been as painful, whereas now it would be seen as painful. Joint pain and excessive clicking of joints. So the joint pain is probably going to be likely, and it can be any joints. It could be in your fingers. It can be in your thumbs. It can be in your knees. It can be in your ankles. All over the place. Excessive clicking of joints as well. So my ankles click all the time, my knees click every time I stand up or sit down, and then my fingers click. There's all sorts of body parts. I know somebody who we now believe probably has it, who's also autistic, and he clicks his neck all the time. It's literally all the time it happens. So yeah, and I've had it since a kid. The clicking, it was a running joke in my family that I was always clicking. Fatigue, extreme tiredness, which can also be very easily misconstrued as things like depression, or it can be because of the fact you feel anxious, that you then think that you're fatigued from it. And also mental fatigue can be part of being autistic in general anyway. So it could just feel like burnout, but actually it could be that this is related to it for you. If you've got some of the other symptoms, fatigue alone is definitely not going to say that you have EDS. Skin that bruises easily. So you can see on my arms, it's not just bruising, it's scarring. Literally, I get bruises on me all the time. I get marks on me all the time. I don't know where they've come from. I scratch really easily. So just a little bit of a scratch on me, and I scratch myself a little bit, and I've got a big scratch. But the other day I held a box which had very little in it. It probably weighed under 1 kilogram, and I lent it on my knee for about 30 seconds. When I took it off, about 2 hours later, I developed a really big bruise on my leg. So it's contact bruises rather than it being a bit of pressure can create a bruise. It was actually part of one of the questions that was asked just generally as part of my assessment for autism was, do I bruise easily? And I didn't really understand where that came from, or do I have bruises that I don't remember where they came from? And I think it's sort of thought from an autistic perspective that maybe because we experience the world differently, and often dyspraxia is a comorbid condition, maybe you're clumsier in that situation, or seen as being clumsier, and therefore may knock yourself and not realise why you've done it. Digestive problems, so indigestion, acid reflux, IBS. As we know, there's lots of conditions that affect our digestive system, and autistic people are known to commonly have digestive problems. There's also dizziness and increased heart rate when standing up, which I get all the time. Sometimes get the white lights. Problems with internal organs, such as mitral valve problems or organ prolapse. This is one that, unless it's happened and it's been seen, that you're not going to know about it. But it is one that I think is probably important for diagnosis, because one of the things that my doctor said is that one of the things that now, if something presents in that way, they'll screen for much earlier. So there is that. And also problems with bladder control. For me, I wet the bed until I was quite old, till I was about 10. I wet it every night, and then when I was about 14 was when I totally kind of stopped. But I do need to go to the toilet really quickly. I suddenly really need to go to the toilet. 1 minute I don't need to, the next minute I do need to. And I think maybe that is linked more to this. I thought it was because of maybe ADHD, or because I wasn't, or because of interoception issues. So not knowing what my internal body was doing, I thought potentially that's what it was. It might still be that, but it may also be heavily linked to this as well. So it might be able to be helped. My doctor's looking at whether there's ways of medicating that to see whether it would work, or if there's other coping mechanisms that I can deal with in relation to it. But knowing that it's potentially a physical problem rather than a psychological one, it can mean, or an internal one that's linked to my neurodevelopmental condition. It could be that actually there is a physical fix to it, which would be really handy. So what I'm going to do now is I'm going to look at sort of going to the GP, what happens there, and then I'm also going to go through the 𝐵𝐸 test, which is the test that you can do. What I'm going to do is I'm going to put a picture, like I say, I'm going to put a picture up of each one of them, because of the fact that there's certain ones that if I show you here, then you're not going to be able to see exactly what I mean, but I'll show you physically what you need to do, but you will need to put your arm against a flat surface to do it. So let's have a look at going to the GP and 𝐵𝐸. So first of all, before going to the GP, I'm sure that if you think this could possibly be the case, then you're going to do lots of research. So like I say, I'll link the details down in the description in relation to the symptoms that I said about, and it kind of goes into a bit more depth about things as well. And it also gives you other EDS, other EDSs that could potentially be the case as well. But what I did was I made sure that I sort of looked at each one of those things and were like, how does this affect me now, and how has it affected me in the past? And then wrote it all down. So I made sure that I went with it together. So all of that information was there for me to be able to go to them and talk to them about it and suggest that this could be the possibility. They were very open to talking about it. The doctor knew quite a lot about it, to be honest with you. It may be embarrassing. Obviously, I needed to speak about things around urinating and stomach problems and things like that. So it can be quite embarrassing, but I can assure you they've heard worse. She was very, very good with it, even with my stumbling way of saying it and very sort of like forthright saying it in the way that I was saying it. They will probably take your blood pressure both standing up and sitting down and see where there's a difference. There was a huge difference between mine. They checked, they looked at my BMI and said that they would track that because from a fatigue clinic perspective, they like to know what your, because that can have an effect on fatigue as well. Whether your weight goes up and down, if your weight changes a lot, then that can affect you from a fatigue perspective. You will most likely have to have blood tests, and they will arrange stool samples and urine samples probably just to make sure that they're checking for everything else. They wanted to check for things like diabetes with me, and there were various other things that they wanted to have a look at. And they'll probably carry out the Baton score test, which is what I'm going to go through now with you. So I'm going to put a picture up in the corner because, like I say, there are some that I can show you and you might be able to see it straight away, but it's very difficult on camera to be able to do it. I've tried to do it already on one of on this video, and it didn't work when I tried to do it, and it just didn't. You couldn't see the full effect of it because of the fact that you need to put your arm, for the first one, for instance, on a flat surface, and unless you do that, you can't really see the effects of it. So it tests your upper and lower limbs to see whether you have hypermobility. So let's have a look at these then. So first of all is the pinky test. So as you can see here, it specifically says to put your arm straight with your elbow flexed, and you can see why this is problematic when you've got to do that. I can't actually get myself into that situation while actually showing you, but basically you put your hand flat and you pull your finger right back. I don't know whether you can see it, but if you pull your finger right back and it goes back more than 90 degrees, then that shows that you have potential hypermobility in your joints in your finger. It doesn't look like it goes, but when it's against something, it does look, it goes more than 90 degrees back. But so you need to put your hand flat against a surface, your elbow flexed, so like that. So it's flexed like that, and then pull your finger back, and it shows you if it goes over 90 degrees. And that includes the tip of your finger going over the 90 degrees. So the next one would be your is the thumb test, which is a bit easier for me to show you. So you put your arm stretched out, and as you can see, if your thumb touches there, that shows that. I can't really show you properly. Again, it's very difficult, but as you can see, your thumb actually touches there. It touches your forearm. Then there is the elbow test, which is the third one. Oops. Get rid of the thumb one. There we go. So the elbow test, you put your elbow out, and if I go backwards there, so you can't see it hugely, but it's here. So you can see how this bit goes up and this bit goes in. Not going to be able to see because I can't put my arm flat to get it there. Let's see if I can do it this way. So you put your arm flat and then your arm, so you can see there that you've got that like upwards V and this bit sticking up. That is an indicator as well. So this is the next one. So as you can see here, the person's knees at the back, so standing straight, if your knees go back, they bend backwards basically. So your knees go in and you're the back of your knees. So you've kind of got, you're going like this with your legs, but backwards, not forwards. You can do that in a mirror, obviously, if you've got a full length mirror, or you can get somebody else to have a look at it for you. And then finally you have back. Now this one, as an adult, you have to score 5 or over out of a potential 9 for you to be seen as somebody who could potentially have hypermobility. And this one is one as an adult that quite often people can't do, whether that's because of back pain or it's just flexibility is not as good as it used to be, or like me, you've put a bit of weight on and your chub gets in the way a little bit. So I couldn't do this properly. I could just touch it with my fingertips, but you need to be able to put it down like that. But they will also ask you, were you able to do this when you were younger? And up until about 5 years ago, I could do this quite easily. So it looks a historic thing, but it was 8 out of 9 even without that anyway. So all of these indicate the fact that you will have hypermobility in joints. So, like I say, I'll link down in there in the description. I'll link down there the actual 𝐵𝐸 test website to have a look at, as well as the other things that we've looked at today. So treatment options that were offered to me. So there's pain and fatigue management clinics. Now, pain and fatigue management clinics. So pain. I'll sort of look at pain first. So pain management clinics look at pain from both a medical perspective, so what painkillers that you might be able to get, so actual treatment in as much as pharmaceuticals, but they also look at holistic ways of doing things. Now I have there's a painkiller that I have called naproxen, which I take when I have flare-ups, which probably happens every other day probably, and I'll take one 250 milligram tablet, and that then kind of covers me for that period. If it's really bad and it lasts a bit longer, it may be that I'll take one later on that day, which is actually a relatively low dosage, but they do a lot of work with you individually. So I'm not going to say what they're doing with me particularly, because I don't want anybody to do what they're telling me to do, because they have different methods depending on you as a person of how they deal with pain, how to look at management through cognitive behavior therapy. But very light cognitive behavior therapy, sort of telling you how to sort of take your mind to different places, mindfulness, other things, light exercise, those type of things that will actually help. And then fatigue clinic kind of looks at the bigger picture of how to both give yourself more energy in a healthy way, and also conserve the energy once you've got it. So it looks at so at the moment I'm looking with my person in the fatigue clinic. I'm looking at nutrition, and again looking at light exercise and how that can help add energy, but doing it in such a way that it's not going to use up that energy you're conserving, and also looking at things you do in your day that you could probably do differently so that you conserve that energy for longer. And when to, and how, so it looks at food, it looks at the things you do, it looks at your, it looks at the way that you're managing your day and how you're planning your day and that type of thing, and can you plan it so that you conserve as much energy as possible, as well as eating in a way that is giving you continuous energy in a healthy way, like I say. Occupational health and physiotherapy. I've not gone for occupational health at the moment, but I am looking at physiotherapy to deal with the hip problem that I told you about, because there's ways of physiotherapy from a movement perspective to how that can work, and I'm hoping that will be really helpful for it, because I get it a lot. And then the biggest thing, it's not really a treatment thing, but it's just understanding what your body is doing. I think that autistic people, we are masters at masking, and that includes masking to ourselves, and that then includes masking pain and not really wanting to bother people. And it has become, I'm starting to feel the fact that now I've put all of these things in place, and it may feel really negative when I'm saying, well, I've had this, I've found out that I have this condition. It's actually been really enlightening for me, because those conditions were there regardless of whether I got the diagnosis or not. But until I knew about these things, there's no way that I would have been able to go to my doctors with this information, for instance. And what me finding out was actually through watching a YouTube channel that I saw it mentioned in, and then I thought, oh, I'll do it as well from the way I do my videos, see whether it helps anybody else to go down that route. because once you understand it, I am not in as much pain now because of the fact I'm able to manage my pain better. And I'm starting to find that fatigue isn't as bad as it was, and I am having a little bit more energy. But the biggest thing is my welfare feels so much better. My own personal welfare is feeling better and better through understanding myself and understanding things that I have been. Like I say, this happened. The pain started probably when I was about 7, and I've probably been in it that whole time. So without even noticing that, that underlying pain, and then the flares up of it, and I kind of realised they were happening every few days. Those flare ups. It wasn't like, oh, it happened every few months. It was every few days. So now looking back at it and think about it from a masking perspective, I was probably in a lot of pain all the time. I just didn't pay attention to it. And I'm starting to feel things in my body quicker, and then also be able to react to it. And it gives me a really positive way of dealing with it. And that's what I want for anybody else that's in this situation, is that if you do think that these things do sit with you and you're experiencing pain, speak to your doctor about it, because there are so many things that can be done, and you don't have to take painkillers. I'm trying my best to not take any medication for it at all, because I'm already taking enough medication for other things. I don't want to take medication for pain unless it's absolutely necessary. And they're really, really good. The pain clinic are really, really understanding, and they really get to know you as a person and how you live. The same with the fatigue clinic. They've been really, really good with me. It's been a really good experience, actually. So yeah, that's my take on this whole situation, and sort of explaining this with you. I hope it's been helpful. And as always, I'd love to hear other people's thoughts on this, and whether you've experienced EDS, or whether about hypermobility, sorry, and if this resonates with you at all. And if you've got any coping mechanisms or anything that you'd like to share with others, that'd be fantastic. I always like people sharing their experiences in my comments. That's what I created this channel for, is for people to share their own experiences. So thank you very much, and I hope to see you on the next video. If you would like to share, like, and subscribe, perfect, brilliant. That would be really appreciated. But don't worry too much about it. Thank you very much, and I hope to see you on the next one. Thanks. Bye.